Hospitals are facing more pressure throughout the UK, and NHS staff are having to juggle competing demands. As for hospital admissions, they are nowhere near the peak that they were in April, but they have been rising, with 1,015 admitted to hospital on average every day in the week up to last Monday. Now, our medical editor Fergus Walsh, cameraman Adam Walker and producer Nikki Stiasny were given extensive access to the Royal Victoria Infirmary, that's in Newcastle, and this is what they found.
The Royal Victoria Infirmary is part of the fabric of life in Newcastle. 15,000 staff work at the trust. They're always busier as winter approaches, but this will be the first with coronavirus.
We've got a very tired workforce.
We know the beast that is COVID pneumonia.
It's devastating if you get a setback.
For a couple of months in summer, there were no COVID patients in intensive care. Now staff are back in full PPE.
COVID continues to make people critically ill. It continues to make people's organs fail. It continues to cause death. That still is a frightening prospect for many people out there.
But patient numbers are half that compared to the first wave, and very few are on ventilators. To me, this feels very different from the peak in April. Doctors now know so much more about COVID and how best to treat the disease. And that means many more patients are surviving intensive care.
We feel we can offer every patient the best possible opportunity to get through it based on some much firmer science that we can draw on now compared with April.
Half the patients, like Brian, are on clinical trials. The 62-year-old is usually behind the bar at a local social club. Then he got COVID.
Terrified. Absolutely terrified. I've had a traumatic few days. We'll just build the strength up, get better. But they will get us better. I know that.
COVID patients in intensive care are given remdesivir, an antiviral drug, plus medications to stop potentially fatal blood clots. They also get dexamethasone, a steroid. Trials in the UK showed it reduces the risk of dying by up to a third. Mohammed came to England from Pakistan in the 50s. A former bus driver, he's 87 and suffers confusion, so his daughter Shameen, who's also had COVID, is allowed to stay with him.
Very close to dying he was, honestly. It was very, very scary.
He lives with his son and grandchildren. Shameen is in the next street. COVID has swept through the extended family.
Thank God.
Allah.
He's going to thank God.
Allah.
He's going to thank everybody that's helped him get home as well.
The hospital is confident it can cope with coronavirus this winter and could expand its intensive care fivefold if needed. But the more COVID there is, the greater the impact on other non-emergency care, the hip replacements, eye operations, a myriad of other conditions. And like everywhere else, patients are waiting longer.
We've got a really significant backlog. Cataracts and eye operations are a good example. Small, relatively simple procedures. But if you're an elderly, frail person, isolating, fearful in COVID times, then, you know, we're pushing those patients into deeper anxiety.
So we've got 7 free COVID ITU beds. I think they're a bit tight on non-COVID ITU beds.
For now, they have some spare capacity, but it's finely balanced, and social distancing means the hospital can't admit as many patients as before. A handful of theatres have had to be closed to free up nurses for intensive care. But surgery that was suspended in the first wave is taking place.
Waiting around, wondering if you're going to get the operation.
Kathleen should have had her thyroid operation in March. she feels fortunate it's now happened.
It's been a little bit tense, waiting around, you know, thinking, am I going to get the operation, am I not? But now it's happened, I'm absolutely elated, it's great.
Around 1 million women in the UK missed out on breast screening in the first wave of coronavirus. The Trust is determined to keep it going this time.
Well done.
The hospital is very much open for business and staff want to continue all services this winter. But so much depends on whether coronavirus can be kept under control.
That was Fergus's report. We'll talk to him in just a moment. But before that, let me give you the latest government figures. And they show that there were 20,890 new coronavirus infections recorded in the latest 24-hour period. The average number of new cases reported per day in the past week is now 21,926. 102 deaths were reported. That's people who died within 28 days of a positive COVID-19 test. And that means, on average in the past week, 182 deaths were announced every day. And it takes the total number of deaths so far across the UK to 44,998. Well, as I say, with me is our medical editor, Fergus Walsh. Fergus, you were telling us there about the way that they're having to juggle these competing demands. And all the while, we're also looking at reports that there's progress being made in the search for a vaccine. So what is your overall picture tonight?
Well, I'm struck, Hugh, by how much better prepared and equipped medical teams are now to deal with coronavirus than they were back in April. So that's positive. And hospitals have plans in place to deal with any surge in COVID cases. And then there are the Nightingale hospitals. But there's only one set of staff. And once the staff are dealing with COVID cases, they can't be dealing with non-COVID patients. So the pressure point this winter, if COVID admissions continue to rise, could be elective, non-urgent surgery. So the vaccine can't come soon enough. Now, the Oxford AstraZeneca team, they've said that their vaccine induces a good, strong immune response in all adult age groups, including the over 70s, the most at-risk group. And they say that's a key milestone, but that evidence hasn't been published yet. Now, some parts of the NHS are already working out the how and the when they might immunise people with a vaccine, maybe before Christmas, because frontline health workers would be first in line. But that's purely speculative, the timing. 20,000 volunteers have received the Oxford vaccine. And because coronavirus levels are rising in the community, we should know sooner rather than later whether it works and is safe. But we've got to wait for the data.
OK, Fergus, once again, many thanks. Fergus Walsh there, our medical editor.